All right. Beautiful. I always have to double and triple check because I want to make sure that we don't miss a second of what our lovely guests have to share. So hello, everyone out there in social media land. Hope everyone's doing fantastic. I wanted to introduce you to a friend of mine, Dr. Kacian Brown, and she is the physician with Call M.Ds. How are you doing, Dr. Brown?
I'm doing well. How are you?
Fabulous. I know you are very busy, and I'm honored and excited to have the opportunity to talk to you for a few minutes. We've been trying to connect. Like I said, you're very busy helping a lot of patients, you and your team. So if you don't mind, like I said, I'm excited for all of our viewers and my followers to meet you and hear what it is that you and your team do, your practice. So tell me about Call M.Ds for those people that might not be familiar with you yet.
So, we're a group of wound care, dermatology, and primary care specialists that service currently the Central Florida area. The beauty about what we do is we're mobile providers and we offer telemedicine visits. So, we come to you in the comfort of your own home or your own facility, and we take care of your needs.
So that's pretty cool stuff. So in other words, if someone can't leave their house for whatever reason, or maybe if they're even in a rehab facility, is that right? If they were in a
Right.
facility as well, would someone from your team be able, or you or your team be able to help them as well?
Yes, absolutely. So we do hospitals, rehabs, skilled nursing facilities, assisted living facilities, home visits, and also we've just added our new platform of telemedicine services. So we're well-rounded in the care that we can provide for everyone, especially during these trying times, this crisis that we have going on.
Yeah. So were you doing telemedicine before, or has the COVID-19 caused that to be a thing, or was that already something?
Yeah, the COVID-19 caused us, we had to figure out how can we still provide the care that our clients need. So COVID-19 caused us to go into the telemedicine platform. And I tell you, we've been able to help so many people for simple things, whether it's medication refills or it's a cough or cold. And oh my gosh, that's the worst thing to have at this time because everyone thinks, oh my gosh, I've got COVID-19. It could be anything. We can take care of it via telemedicine, even your wound care and your dermatology as well. We
Yeah.
have a video platform that we can use that helps us to figure out what's going on.
Yeah, that's crazy. When you were telling me about that, that you can actually help someone with, like, if they have a mole or a spot on their body, right? Which is very
Right,
relevant to people living in, I guess, everywhere. But I always think of Florida, especially since so many
right.
people grew up in the, you know what I mean, frying themselves,
Hmm.
myself included, out in the sun. So that's a big deal. And how I didn't we didn't talk about this earlier, so I'm not to put you on the spot, but I know some people that had some malignant, I guess you'd call it skin cancer, some spots on their skin, and if they would have delayed and not had that attended to, early, that really could have been a big deal. So I'm guessing, like you said, if people right now are have something maybe on them, a lesion or something that's a spot that they're concerned about, if they wait till things go back to normal, right? That
Right,
could really be
right,
a mistake, correct? I mean, they don't want to wait
right.
on certain things.
We're huge on precancerous and skin cancer, simply because exactly what you said. If you wait, I hate to say, but even a week in delay can be a huge deal.
Yeah.
So we service our patients from head to toe. We're going to do a full skin evaluation and see what's going on. Sometimes it's simple, we can freeze it off. Sometimes we'll take a biopsy and send it off. Sometimes we do a surgery and we completely cut it out. It's excisional biopsy. However, it beats waiting and then having to go through, oh my God, skin cancer is it's just not a good diagnosis to have. And sometimes you need chemotherapy, radiation, and that comes with its own set of complications.
Yeah. So, big question, and I'm sure some people, there's no question that everyone can, I think, that everyone could see a need for your practice, for your service. But what about payment? So, is it all self-pay? Do you take any insurance? Do you need a referral from like a primary doctor? How does that work?
Honestly, it depends on your health insurance. And
Hmm.
that's why we'd rather you call the office. We're going to run your insurance before we do anything. We accept self pay, but also for telemedicine, any insurance we can accept. For wound care and dermatology, It's only PPOs that we can accept. It's so hard, the insurance industry, to understand it. So just go ahead and call our office, and we have specialists in insurance who will run your insurance and tell us whether it's okay, what your copay is going to be, everything that you need to know that'll happen at your visit. We'll let you know.
So that's great, by the way. That's a really big deal. And to your point, like you said, everything, I'm sure it's very case specific, right, to each person, what they have. But that's nice to know that that someone could call you too. And it sounds like you'll work with them even if they can't get a referral, or even if they don't have insurance, that they could do self-pay. A lot
Absolutely.
of folks that are in some of my groups online work and are decision makers at rehab facilities and assisted living. I'm looking at my notes because I wanted to make sure I mentioned that. If someone, in other words, at one of these facilities, rehab centers or assisted living, was looking to have someone that could come in, would you come in right now, even with the COVID-19, or does everything need to be done virtually?
Oh, no, absolutely. We would come in during the COVID-19 because we've implemented PPEs before PPEs were a thing. So as soon as we saw what COVID-19 was doing, our staff has been equipped with masks and gowns and gloves and hairnets and shoe covers. And the lucky thing is we did it prematurely, and it has worked out to our benefit. So we're totally covered from head to toe. We go into our facilities currently and see patients. So absolutely, we are accepting new rehabs and new assisted living facilities. Just go ahead, give us a call, or go on our website, and we'll be happy to take care of your facility and your residents.
That's fantastic. Now, 2 quick questions then in relation to that. What about territory? Central Florida, how far, so to speak, does your team go? I know you have a team of nurses and yourself. So yeah, where's kind of the limit to the geography of your area, territory?
So my nurse practitioners and I, we go all the way up to Jacksonville, all the way down to Kissimmee, Poinciana. So we do it by county. Oh my gosh. So there's Orange, Osceola, Polk, Volusia, Seminole.
Yeah.
And there's one more I can't remember, but we have a very, very wide area. With that being said, we're looking to spread our wings. So there is no area that's too far that we can't go, because there are patients everywhere who need our help.
That's a great point. If someone was an RN that wanted to talk with you about joining the team, could they, like in one of those territories? Is that something you're always looking for, good people to join the team?
We are looking for good people, but we hire nurse practitioners, PAs, and MDs.
Got it.
So we also hire wound care techs, and they're an assistant that goes around with our providers, and they assist with whatever it is they need, lifting a patient, turning a patient, putting on a dressing, so that our providers can be flexible to see patients efficiently.
That makes sense. That makes a lot of sense. Well, great. I'm excited. What a great service. That's why I was genuinely excited to have you on, so we could let everyone know the great work that you're doing and let them know that you're accepting new patients, especially right now.
Absolutely.
Yeah, really important. Now, where can people find you, Dr. Brown? You mentioned your website. Is it, you have a Facebook page, correct?
Yes, we do. Our website is www.woundmds.com. WOUNDMDS.com. Our office number is 407-426-4800. And on Facebook, if you type in Wound MDs, we'll pop right up.
Awesome. Well, I encourage everyone to go and follow and like your page, because we all know how that is. And it's great when you're already following a page, and that way when you disseminate out information or announcements,
right,
make sure that you can get those notifications as well. So
yes,
great.
Yes.
Well, thank you so much. I know, like I said, I'm looking at my clocks. I'm cautious of the time because I know you're slammed and doing a lot of good work for a lot of people out there. So listen, stay well yourself.
Absolutely. You too, Tobi. You take care, and thanks for having me.
Oh, thank you. I'll talk to you soon. Thanks, Dr. Brown.
All right. Bye-bye.
Bye-bye.